Hey guys, Dr. Sinacropi here. I'm back in the office seeing patients, what I love doing. Came back from this trip lobbying in DC, and what a learning experience it really was. We had an opportunity to sit down with some really influential Congress people. Also had the opportunity to have really good discussion with some lobbyists and learn about an entire world that is not necessarily familiar to me. The DC culture is extremely different than, for example, the hospital culture or something like that. It's quite a different world. But one of the things that I heard loud and clear, and one of the things that we were out there lobbying for, is the fact that so many good programs, research facilities, things like that are definitely in the crosshairs right now and losing a lot of funding. Now, I will tell you, I'm very much in the camp of being efficient and fiscally responsible. I talk about it all the time, the fact that where we're going in healthcare is not sustainable. However, attacking this problem with a blanket approach is leaving us with potential structural changes that are going to be hard to reverse. So, for example, if a very innovative company is one that utilizes funding to promote scientific research and their funding is taken away and they go out of business, this could have been the next solution to whatever problem they're trying to solve. Same thing goes for university laboratories and other places that are funded. To be honest with you, because this doesn't touch me as much, sometimes we really have to learn. And I heard so many heartbreaking stories directly. In fact, some were in our delegation of people, whether it be in institutional situations or in private industry, losing a significant amount of government funding. And these people are really doing excellent work. Now, without question, there's going to be waste, fraud, and abuse anywhere. That's just part of the way that things work. And we have to actively really root that out. But I think we need a more surgical, clinical approach to really getting to the bottom of what is funded and what is not funded. And unfortunately, the strategy right now is not optimal. So I'm not pretending that I am going to come up with political solutions, since that's not my world. But what I can do is I can be part of a team that's out there in DC, out with our own Congress people here in Minnesota, lobbying to protect the good work that is being done by legitimate clinicians, scientists, and others. So that's my takeaway from DC. Hopefully this helped in some way. Let me know what you think about it in the comments. Do you think that we are taking too broad of an approach right now, no matter what side of the political spectrum you're on? You guys know me, you never hear me talking about, politics publicly, but no matter what side of the political spectrum you're on, I think that you can understand the idea that this might not be the best approach. But let me know what you think. Let's start a conversation. Really want to know what people are thinking. If you're a clinician or researcher out there that has had your funding taken away, let us know. Tell us your story, so we can get it out. We might even feature you on one of the channels talking about your story, so we can really protect progress and moving forward when it comes to helping our patients. So we'll see you on the next video. You guys have a wonderful day.